Hello, I'm Adriana at In-Home Psychiatric Services. Today I want to talk to you about something we see far too often, post-hospital syndrome, and why it matters so much for residential and home health staff like you. What is post-hospital syndrome? Post-hospital syndrome is a short-term acquired condition of vulnerability that affects patients, especially older adults, after they leave the hospital. And here's the thing. It's not about the illness that got them admitted. It's about the damage done during the hospital stay. Think about it. Sleep deprivation, poor nutrition, bed rest, confusion, loss of independence, and emotional stress. By the time patients get discharged, they're not fully recovered. They're often more fragile than ever. Here are some warning signs that a patient may be experiencing post-hospital syndrome. They stop speaking or withdraw socially. They're refusing meals or medications. They're sleeping much more or much less. They appear confused or emotionally flat. You might assume it's just part of aging, but often it's not. This could be severe depression, hypoactive delirium, or even a relapse of a pre-existing mental health condition. Here's a real-life example. We had a patient, a 70-year-old woman named Ms. E, who came back to her facility after being treated for sepsis. At first, she was alert and recovering well, but within days, she became completely nonverbal, silent, still, withdrawn. Staff were worried it might be dementia or a stroke. But what she really had was a major depressive episode triggered by the stress of hospitalization. Once we started treatment and provided consistent care, she returned to baseline in just a few weeks. Post-hospital syndrome increases the risk of false medication errors, emergency visits, psychiatric crises, and even premature death. The good news? It's preventable, but only if we catch it early. Here's how you can help. First, re-establish a routine. Wake-up times, meals, hygiene, and sleep should be consistent and predictable. Second, screen for mental health symptoms. Use tools like the PHQ-9 for depression or the GAD-7 for anxiety. Third, look closely at medications. Many patients have their psych meds changed or stopped during the hospital stay. These need to be reviewed ASAP. Fourth, document changes. If someone suddenly isn't talking, isn't eating, or seems confused, let your team know immediately. Post-hospital syndrome is real, and it's dangerous. But with your help and early psychiatric follow-up, we can catch it, treat it, and help patients get back to themselves again. If you're caring for someone who's just been discharged and something seems off, don't wait. Reach out. We're here to support you. Thank you for watching, and thank you for the care you provide every day. If you would like to make a referral to In-Home Psychiatric Services, please contact us to schedule an intake. We are a team of highly trained psychiatric providers and therapists. We pride ourselves on providing evidence-based care. Thank you for taking time to listen to this presentation. Also, this information is also available as an article in our blog at ihps.com. Have an amazing day.